Good afternoon and welcome to the December 2011 Public Health Practice Grand Rounds. My name is Molly Mitchell, and on behalf of the Mid-Atlantic Public Health Training Center and the Department of Health and Mental Hygiene, I'd like to welcome you all to today's presentation on public health and the alcohol tax campaign, how Marylanders beat the alcohol lobby and why it matters. Before we begin today's presentation, for those of you watching online, I'd like to just bring your attention to two things. One, we please ask you to sign in so that our federal funders know who is watching. And also, if you have any questions at all during the presentations, feel free to click on the link and you can email questions to either of our presenters. Also want to just draw your attention to some of our online trainings on our website. We have a lot of our archived grand rounds on there. And we also have some upcoming face-to-face trainings, which include social marketing on January 24th and community assessment and formative evaluation also in January. And next month's public health practice grand rounds, which is on TB in prisons and jails and the public health challenges and strategies with Rear Admiral Newt Kendrick and Sarah Burr. So with that, I'm going to go ahead and introduce today's presenters. David Jernigan. Dr. Jernigan is an associate professor in the Department of Health, Behavior, and Society and the director of the Center on Alcohol Marketing and Youth at the Johns Hopkins Bloomberg School of Public Health, where he teaches courses on social and behavioral aspects of health, media advocacy, and alcohol policy. He has worked as an advisor to the World Health Organization and the World Bank and was principal author of WHO's first Global Status Report on Alcohol and Global Status Report on Alcohol in Youth, and co-authored Media Advocacy and Public Health, Power for Prevention, and Alcohol in the Developing World, a Public Health Perspective. Our second presenter today is Vincent DeMarco. Vincent DeMarco is a longtime advocate for public health issues, including reducing teen smoking and gun violence, and expanding healthcare access, and the subject of a new book entitled The DeMarco Factor, Transforming Public Will into Political Power. As president of the Maryland Citizens Health Initiative, he is working to guarantee quality, affordable health care for all Marylanders. His work has resulted in legislation which has substantially reduced smoking in Maryland and has expanded health care insurance to over 150,000 people. He is national coordinator of Faith United Against Tobacco, a national coalition of leaders from across the country working to reduce smoking, which played a key role in the enactment of landmark national legislation to authorize the FDA to regulate tobacco products. He is an adjunct assistant professor at Johns Hopkins Bloomberg School of Public Health. He has been recognized for his work by the organizations such as the Baltimore Sun, which declared him Marylander of the Year in 1988, the Central Maryland Ecumenical Council, which awarded him its 2002 Ecumenical Leadership Award, and the Daily Record, which named him one of Maryland's 60 most influential people in 2010. So with that, I'm going to hand the floor over to Dr. Jernigan.
Thank you. It's a pleasure to be here and to be on the same podium with Vinnie DeMarco. This was an amazing campaign to be part of. And my job is to tell the public health side of the story, and then Vinnie will tell the organizing side. So just to begin with, excessive alcohol use is a significant public health problem, and raising alcohol taxes is one of the most effective strategies for reducing and preventing excessive alcohol use. The research base is very, very strong, but few states succeed in passing alcohol tax increases. And the Maryland campaign was the model for what a successful campaign, in my view, should be like, a real partnership between public health and political organizing. Excessive alcohol use is the third leading lifestyle-related cause of death in the U.S. after smoking and diet and physical activity, responsible for about 79,000 deaths a year. It's the leading drug problem among young people. And in the state of Maryland, it's responsible for 1 out of 3 deaths of persons between the ages of 15 and 20. The effective strategies for reducing and preventing alcohol use, and this isn't opinion, this is from a very large global review of the research literature. What we try to do is to reduce overall alcohol consumption, and one of the most effective ways to do that is to increase taxes. We try to reduce heavy drinking, and increasing taxes is an effective way to do that. We try to prevent and delay the onset of use, and increasing taxes is an effective way to do that. Why are taxes so important? Well, in this respect, alcohol is an ordinary commodity in that the law of demand applies. The law of demand, one of the basic laws of classical economics, is that the quantity demanded of a price will rise in inverse relationship to its price. So when the taxes go up, the price will tend to go up, and when the price goes up, people drink less. And this includes heavy drinkers, and it includes young people. And when people drink less, there are fewer alcohol problems. In fact, the evidence suggests that the evidence is substantial, and the reason that it works this way is because alcohol demand is what economists call elastic. So that alcohol is not a necessity product. When the prices go up, people will actually consume less of it. According to one analysis, a 10% increase in the price of alcohol in the U.S. would lead to about a 7% drop in beer consumption, about a 5% drop in wine consumption, and close to a 15% drop in distilled spirits consumption. The biggest downside to raising taxes is issues about control of the market, like smuggling, cross-border purchases, and things like that. So taxes will only work if these are not a significant factor. The reasons for raising alcohol taxes, the public health research literature, there are two things that we do around alcohol where the literature is largest and most robust, and one is around minimum drinking age of 21, and the other is taxes. But not just for the public health research reasons. The politics of alcohol taxes, opinion polling finds over and over again that the public supports alcohol tax increases, especially if they're earmarked for good things, as in this case, developmental funding for people with developmental disabilities, mental health services, alcohol and other drug services, and so on. But there are some other reasons, and let me walk through them quickly. One is the economic principle of fairness, that if prices are too low in an economic sense, that is, they don't cover the cost of production and consumption, then people will drink too much economically, in that the utility provided to the drinker of some of those drinks, particularly those at the margin, is less than the costs of production and consumption, including the cost to society. Now, the latest study from the Centers for Disease Control about the costs of alcohol to society estimate that alcohol costs us about $1.90 for every drink consumed. And taxes don't come anywhere near recovering that cost. So low alcohol prices are bad economics. They're also inefficient. The alcohol taxes can correct for some of the negative externalities of alcohol use, which are the bad things that happen to other people because of the drinkers drinking. And they can also correct for some of the inefficiencies of the alcohol market. Alcohol producers are an oligopoly, particularly beer. Two companies are responsible for approximately 80% of all the beer sold in the U.S. And this enables them to charge artificially high prices. And in fact, every year, there's a ritual in the fall where Anheuser-Busch announces a 3 to 4% price increase, and the rest of the industry follows. And then there are the revenue needs. And the fact of the matter is that alcohol taxes used to pay for a whole lot more of government and public services than they do now. This tracks things just since 1977, but you can see the the turquoise and the green curves here are the decline in total revenues in constant dollars over time. And then this light blue line down at the bottom is, the green line and the light blue line are the decline in federal and state revenues, respectively, and the turquoise line is the decline in the percent of total federal tax revenues made up by alcohol. And it starts from a fairly low level, about 1.5%, but goes down to an infinitesimal level of about 0.4%. So there are revenue needs. And part of why this is an issue is because most alcohol taxes are flat taxes. They're based on the volume of the beverage. And so the volume of the beverage doesn't change, but inflation goes up every year. In essence, this industry gets a tax cut every year because the tax rate does not keep up with inflation. Here you can see these are nominal tax rates converted to cents per ounce in consistent 2005 dollars. And you can see there's a little bump right here in 1991. This is when the federal tax on alcohol went up, but the effects of that tax have mostly decayed since that time. Many states try to raise their alcohol taxes every year, and this is just a graph, and you can see something striking about the graph, which is that it's much easier to do this in odd-numbered years than even-numbered years, and that's, of course, because the even-numbered years are election years. But if we drill into this a little bit, you can see that in 2009, 40 states considered an increase, 8 of them passed one. 23 states considered one in 2010, 0 passed. Why don't they succeed? Well, this Maryland case study is a study in what you have to do in order to succeed. They don't succeed because there's a lack of organizing, because there's not a sufficient constituency behind it. There's a lack of relevant public health data and spokespeople, and there's tremendous opposition. The alcohol industry knows that increased taxes mean increased prices, mean lower sales of alcohol, and consistent industry political donations and lobbying are aimed at keeping alcohol taxes from increasing. My first experience with trying to raise state alcohol taxes was years ago in California. In 1989, the state passed a tobacco tax that funded all sorts of wonderful things like California's very effective tobacco counter-advertising campaign. So we tried a similar thing on alcohol in 1991, the same very similar coalition behind it, the same legislators behind it, et cetera. The alcohol industry spent $40 million to defeat it. It even put its own initiative on the ballot, because this was by ballot initiative, calling for penny a drink. We were calling for nickel a drink. It was to confuse the voters. It was a recession year, and all the revenue-raising measures lost. The only win we got is next year the legislature raised the tax on alcohol by a penny a drink because the industry had shown it was willing to live with that. Other recent experiences, Massachusetts included alcohol for the first time in their state sales tax in July of 2009. This is a classic case of having an insufficient coalition behind your tax increase. The tax was repealed at the ballot in November 2010. Illinois, the governor needed money to fund infrastructure improvements, no coalitions, no public health voice to speak of, but substantial increases in the tax because he had the political will in the legislature to do that. And then Maryland, what we're talking about here, which we'll go into more detail. What did we do in Maryland to build the public health case? We simply tried to collect everything that we had on the mortality, morbidity, and costs of alcohol use in the state. We looked at the public health research on effective responses and summarized the research. We modeled the public health impact of an excise tax, of a tax increase, and we did research that was designed to counter the likely alcohol industry arguments. So what did we find? For instance, as I said at the beginning, it's the leading drug problem among youth, causes 1,278 deaths and 70,470 violent crimes in Maryland every year. About 343,000 Marylanders meet the criteria for alcohol abuse or alcohol dependence. So we looked at costs. I mentioned the CDC cost study. This is the most recent one. It's about $746 per adult in the U.S., total of $223 billion, slightly higher than the cost of tobacco. Much of this due to lost productivity, and 3/4 of it coming not from alcoholics, which are the people who get much of the focus for alcohol services, but actually from binge drinking episodes, from people who are otherwise moderate or quote-unquote social drinkers, but who drink too much. There are a lot of those people. They drink too much a lot. They cause a lot of problems. All right, so the evidence suggests, and I've said this before, but this comes from systematic reviews of the literature. The top one done for the World Health Organization by a group of 15 researchers from around the world. CDC's Community Guide to Preventive Services does systematic reviews of the literature. Philip Cook's an economist at Duke University. He's actually published a book on this, done a number of studies. And then the science arm of Congress, the National Research Council and the Institute of Medicine, also looked at this in 2004. In the World Health Organization's global strategy on alcohol, pricing policies, including tax, are one of the 10 key areas. So what's the evidence? The most recent meta-analysis looked at 110 studies containing more than 1,000 estimates of the relationship between tax and price of alcohol and alcohol consumption. And I quote, "A large literature establishes that beverage alcohol prices and taxes are related inversely to drinking. Effects are large compared to other prevention policies and programs. Public policies that raise prices of alcohol are an effective means to reduce drinking. The Centers for Disease Control concludes similarly, we recommend increasing the unit price of alcohol by raising taxes based on strong evidence of effectiveness for reducing excessive alcohol consumption and related harms. Public health effects are expected to be proportional to the size of the tax increase." So this just illustrates the issue with alcohol taxes being flat taxes. This shows you where the taxes would be if they'd been adjusted for inflation at the federal level since they were first set in 1951 when it was $9 a barrel. In 1991, the beer tax was raised to $18 a barrel, but adjusted for inflation, it ought to be $76 a barrel, substantially higher than where it is now. The case is similar for spirits and wine. The public health goals around alcohol taxes, it makes sense to tax based on the level of the high-risk agent in the product. And so this is where we get to, we'd like taxes to be equalized based on alcohol content. We'd like them indexed to inflation, so they go up every year with inflation. And we're also increasingly in favor of setting minimum prices. This is to avoid things like what's happened in the UK in the last decade, where a torrent of cheap supermarket booze has transformed their drinking culture and led to very substantial problems, particularly among young women in their 20s. So if we did this in Maryland, and this is an analysis that the Speaker's office actually asked us to do at one point during the alcohol debate, if we adjusted the Maryland taxes for inflation, they'd be 47 cents per gallon. And if we equalize them to spirits, they'd be $1.53 a gallon as opposed to 9 cents a gallon, which is what they are now. Similarly, the spirits tax, currently $1.50 a gallon, and if it were adjusted for inflation, $12.20 a gallon. All right, I've talked about elasticity, but the beauty of the elasticity issue for alcohol is that alcohol taxes are a win-win for governments. Governments can increase the tax and price and then get more revenue, and at the same time depress alcohol consumption and reduce alcohol problems. And the problems that are reduced, and these are specific studies that have been done on these outcomes showing that changes in alcohol tax and price will influence the prevalence of these health problems in the population: liver cirrhosis, DTs, male suicide, criminality, hospitalizations, alcohol-related disease mortality overall, workplace injuries, sexually transmitted diseases, interpersonal violence, rapes, robberies, severe violence towards children. And interestingly, if you raise an alcohol tax, there's no apparent impact on possible health benefits of regular, very light alcohol consumption among moderate drinkers. So in Maryland, we did a bunch of modeling. The first thing we had to do was to model how big the tax would be, how much money it would raise. We estimated we had initially modeled a dime a drink. That was the initial request of the coalition. We estimated it would raise the prices by about 6.5% across the board and lead to about a 4.25% decrease in consumption, and would generate about $215 million in new revenues. And then we went health problem by health problem, and where we could get data and there were credible studies that we could use for our modeling, we actually modeled that it would save 33 lives a year, that it would prevent, for instance, 13,000 cases of alcohol dependence or abuse every year in the state. We also worked to respond to some of the industry's arguments. The industry argued that the tax increase would be bad for the economy, would cost the state jobs, that it was regressive, hitting poor people the hardest, and that it would force people to cross borders to buy their alcohol and thus be a money loser for the state and its businesses. So taking those one by one, is it bad for the economy and the jobs? Well, the initial proposal will raise $215 million, and that money doesn't just disappear. According to the original proposal, it would have been spent in the relatively labor-intensive fields of healthcare, developmental disabilities, and alcohol and other drug prevention and treatment service delivery, as opposed to where it's currently spent, which is the employment comes in the alcohol industry, which is highly capital-intensive. We also estimated it would save the state of Maryland at least $225 million in healthcare costs, criminal justice costs, property losses, and so on, including substantial productivity gains, an estimated $132 million for more attentive and fewer absent workers. Are alcohol taxes regressive? This is a really interesting thing about alcohol. It is a luxury product, and although if you drink, you're more likely to drink more as a drinker, the fact of the matter is that fewer poor people drink than rich people. And if you look at binge drinking, which is the risk behavior that's responsible for 3/4 of alcohol problems, what you find is that binge drinking is actually most common among people who make $75,000 a year or more. Which is powerful evidence, harmful use of alcohol actually rises with income. The cross-border issue, we did a systematic review of the literature, studies of this in the U.S. The studies were frankly all over the map. Some found no effect for beer, some no effect for spirits, and vice versa. But when the effect was found, the studies agreed that the effect was not large enough to significantly impact a state's ability to raise additional revenue. And only one study actually interviewed consumers after a tax increase about their cross-border shopping behavior. The increase was in Iowa. It was roughly the same size as the Maryland increase. Now, only 3% of past year and none of past month drinkers increased their cross-border shopping. We also compared the actual alcohol prices in Maryland and 5 neighboring states. We rented some grocery and liquor store scanner data and found almost no relationship between average retail price and the alcohol excise tax rates for spirits, and only a very slight relationship for beer when looking at the cheapest beer brands. Our conclusion was that alcohol is actually highly price competitive across borders, with retailers adjusting prices to meet competitive pressures and maximize profits. So we did not expect that cross-border shopping would have a significant impact on the state's ability to raise the anticipated revenue. And this is just a graphic showing the correspondence or lack thereof between beer excise taxes and average prices as they're actually charged in the 6 jurisdictions. We learned a lot from this campaign, and so we have a future research agenda that we hope will be helpful to future research campaigns. We've been funded by the Centers for Disease Control to set up a research collaborative that's going to evaluate the effects of the recent tax changes in Massachusetts and Illinois. We've also applied to the state of Maryland to evaluate the Maryland tax increase. We're also going to rent space. Economists at the University of Illinois at Chicago will rent space on one of the giant macroeconomic models and actually do some modeling to estimate the precise numbers of jobs that we can expect would be lost and created in the wake of various alcohol tax increase scenarios. We're going to do some case studies here at Hopkins about how the research gets translated, including a case study we're developing on the Maryland situation, trying to fill in, as I say, some of the gaps in the alcohol tax research. And then we've also been funded by CDC to do an action guide oriented primarily to public health departments with a secondary audience of state and local coalitions interested in this issue, looking at what it actually takes to increase alcohol taxes. There are a number of things to look at in terms of assessing readiness. Certainly it's helpful to have a well-positioned champion in both houses of the legislature, to have an understanding of the political strength of the alcohol industry and its allies. It's pretty important to have the support of the governor, to know whether earmarking designating the funds is permissible in your state. If you have a high proportion of non-drinkers in the state, chances are it may be easier to get popular support, as well as if you have a high proportion of evangelicals or fundamentalists. Support of major media, low taxes relative to surrounding states, little cross-border trade in alcohol, the number of years since the last increase, and the ratio of state government alcohol costs to the revenue that the government actually takes in from alcohol. These are all important things to look at. Some of them were true in the case of Maryland, some of them weren't. But certainly we did have budget deficits, and so many states have those at this point. But most importantly, and by way of introducing Vinny, we had an incredible group of advocates and an incredible coalition that could take the research findings and bring them to the public, to the media. It's also important to look at the availability of funds that can be used for legislative advocacy and the existence and efficacy of a lobbyist for the issue. Not every state will have Vinny DeMarco, but a lot of states can learn from what he does. So it's my real pleasure now to switch slide sets and bring Vinny up to the mic.
Thank you very much to the Mid-Atlantic Public Health Training Center for having us, and it's a great honor for me to be here with David Jernigan. He is, as you all know, an international guru on the alcohol issue, and we're just so lucky to have him here in Maryland. And as you'll see in my presentation, he played a key role in our success. As Molly said, I've had the great privilege and honor over the years of working on public health issues with people in this building and in Hampton House many, many times on reducing gun violence and teen smoking, underage drinking, and expanding healthcare. And one of the things I learned in working on these issues is that the vast majority of the public strongly supports the public health measures like raising the alcohol tax that David talked about, but not everybody. And we all know the people who are part of that small but loud minority that oppose what we're doing, that consider us the public health Nazis, that call David and me names like that. And I'll never forget when I was making a presentation in my own neighborhood in Northeast Baltimore to get their support for reducing gun violence. They supported it. It was great. A couple years later, I went to get their support for increasing the tobacco tax, and this really big guy in the front of the audience got up and said, "Aren't you the guy who came after my guns? Now you're trying to take away my cigarettes. Next thing I know, you're coming after my ham." And I assured him we're going to leave his ham alone, but they supported what we were doing, and we made some progress. My point is that there are the loud but vocal small minority of people who oppose what we're doing, but they aren't the reason we don't make successes in these areas. The reason are powerful vested interests who have a lot of money and who pour a lot of money into opposing the public health measures we propose because they make money off the status quo, off the sales of alcohol, sales of cigarettes, and guns. And they have managed in Maryland up until this year to block increasing the alcohol tax for 40 years. And we have one of the lowest alcohol taxes in the country. Similarly, they stopped for years increases in the cigarette tax and progress on reducing gun violence. But a group of us in Maryland put together what we call a 6-step process to overcome this opposition, and it's worked. It's worked this year on increasing the alcohol tax, and it's worked on tobacco taxes and reducing gun violence, and it's a process that is discussed in this book that Molly mentioned by Michael Perchik of former FTC chair, called DeMarco Factor: Transforming Public Will into Political Power. And if you're interested in more about this process, I urge you to take a look at this book by Michael Perchik. So what I'm going to do today is talk about this process, how we applied it and successfully to the situation here in Maryland on the alcohol tax. But I want you to think about this as broader. This is a process that works when you have a situation, a public health measure that works, you have strong popular support, and you have a powerful vested interest opponent. In each of the campaigns I've worked on with this process, it looked like before we started that it was impossible. We were told to get lost. You could never raise the alcohol tax in Maryland, never raise tobacco tax, never reduce gun violence, but we did. And the 6 steps that you see on here are: 1, come up with a smart public health policy; 2, do some serious public interest polling on the issue 3, build a powerful coalition. 4, use the media to the hilt. 5, make it an election issue. And 6, take it to the legislature and get it passed. So we'll talk about each of these steps and how important they are. Step 1 is coming up with a plan to deal with the problem. The problem we're talking about here is underage drinking, lack of money for health care. How do we do that? And we're lucky in Maryland to have the Hopkins School of Public Health and people like David Jernigan that we could go to them and say, how do we address this problem? And David said, raise the alcohol tax. And that is a smart plan that we knew right away because of evidence that David taught us from other states works. One of the things we had to do, though, was get that message out to the public, not just the broader public, but also the advocates. One of the things that astounded me for years is that the leading legislators who were pushing an alcohol tax, and even some of the leading advocates, had no idea that increasing the alcohol tax reduced underage drinking and saved lives. They didn't think it could do that. They just wanted the money for these public health purposes, which was great. But until they knew that the alcohol tax had this other benefit, they were hamstrung in their ability, I think, to get it passed. So we went to David and we asked him to do a study in Maryland. Now, there were national studies and they were fine, but the people of Maryland, the legislators and the policymakers and the advocates in Maryland wanted to know, how does it benefit us? That's why David did a Maryland-specific study of how many lives were saved by increasing the alcohol tax. And this had a dramatic impact. Our legislators now knew this, now could talk about this with their colleagues. And I'll tell you about one critical meeting we had with a key leader in Maryland, the Speaker of the House. Speaker of the House had been a strong opponent of alcohol taxes for years. He supported our tobacco tax increase, but he always said to me, alcohol taxes hurt people. I don't want to work on those. I don't want to propose those, support those. But David showed him that study. He read the study, he had a meeting with David, and he became convinced, and ultimately became one of our strongest supporters. So these studies can have a really, really major impact. David talked to you about what the studies say and how important it is. It's very important to do step 1 right and to have a smart, evidence-based plan to deal with the problem. Now, I've done the same thing on tobacco and on healthcare. Professor Brad Herring, who's in the audience here, is part of a group from this building who put together a healthcare plan for us. So come up with a smart plan to deal with the problem you want to address. Okay, that's step 1. Step 2, you want to know where the public stands. On each of these campaigns, we started with a situation where the policymakers were saying, get lost. Never going to happen. But what did the people of Maryland think? So we did some polling. Now, clearly, there is strong support for alcohol tax increases, and David shows us that from around the country. But we wanted to know more. How strongly do people support an alcohol tax increase? So we asked a series of 3 questions, and this is where we got really important data. In the next election, for whom are you going to vote, a Democrat or a Republican? Just a straight-up generic test, and the Maryland's a blue state, so Democrat was up by about 16 points, as you see here. But then we asked, what if the Democrat supports increasing the alcohol tax and a Republican opposes it? Well, you see suddenly the Democrats up by 24 points, a significant switch to the Democrat. But then we asked question number 3, what if the Republican supports the alcohol tax and the Democrat opposes it? Well, suddenly the Democrat's down by 10 points. Now, this is significant. This kind of polling is what the policymakers, the legislators who are up for election really want to know. They want to know that the voters care about this issue enough to make it a voting issue. So that was critical number 2, is get that polling data and get the word out about it. Step 3. Now, this is very important, coalition building and building the grassroots support. I talk to people all around the country, and I see and I hear and I talk to them about the fact that advocates make the big mistake of going from step 1 and maybe step 2 all the way to step 6. To the legislators. They skip this critical process of building the broad-based coalition. We know from our polling that the strong majority of Marylanders supported the alcohol tax increase. They would make it a voting issue, but we need to mobilize them. We need to get them engaged, and that takes a while. It takes time, and we always spend at least a couple of years ignoring the policymakers, ignoring the legislators, and instead talking with the people of our state. Key is the faith community. You want to reach out to different kinds of groups and bring a broad-based coalition, but I always found it's important on a public health campaign where you're trying to beat a vested interest opposition is to reach out to the faith community for 4 key reasons. They have strong moral authority. They have the authority that legislators have to pay attention to. Second, that's where the grassroots is. That's where the people are who can make the calls, write the letters. You know, when you're battling the alcohol industry, there are these little alcohol shops on corners where people come in and write these notes to their legislators. The best way to overcome that is by having churches, synagogues, mosques, faith places where people can go in and be mobilized and write their letters and contact their legislators. That's where the grassroots is. Third, media. The media loves the faith community taking on big tobacco. The alcohol industry is like a David versus Goliath battle that's guaranteed to get you top media coverage. And it happened with us on all the issues I've worked on. When I worked on the tobacco campaign, we had our faith leaders together, and the head of the United Methodist Church said that he wanted to kick the butts of the tobacco companies. He was livid when that wasn't in the paper, but what was in the paper was the head of the Lutheran Church saying that for years the Methodists had gotten all excited about tobacco and we Lutherans had made fun of them. I'm here to say the Methodists were right, and the Lutherans were wrong, and we're going to work with the Methodists. And that was in the paper, and that was front page of the Baltimore Sun. And similarly on alcohol, we got tremendous media attention when the faith community took on the alcohol industry. And fourth, diversity. You build tremendous diversity for your campaign when you reach out to the faith community. Racial, economic, social, political, cross the boundaries, people come together and through the faith community and your effort. It's important to recruit key leaders within them. It's important to reach out to many groups. And it's very important to have a document. Let me start with this. You have a 1-page document to take to organizations, a resolution. And I think that's very, very important. A lot of advocates don't do this. They'll go in and talk to an organization, tell them why they should support us, and then leave without having something in their hand. Have a document that they can put through their process and endorse and be part of your effort. And then you make a list of all the supporters. And we have hundreds of organizations, thousands sometimes, that are part of our coalition. And that has a big impact on policymakers when they see these powerful organizations supporting this effort from one end of the state to the other. In the process, you go around and make sure you get a lot of groups within the districts of the key policymakers, the chairs of the key committees, president and Senate, House Speaker. You make sure there are people in their districts also. This process takes time. And one important thing about this process that I want to emphasize is it is not lobbying. A lot of my colleagues from around the country get scared when they can't do lobbying, or their lobbying is limited, and they're afraid to take a resolution like this and take it to some organizations to sign. But when I take an organization calling for an alcohol tax increase to the United Methodist Church, to the NAACP, that is not lobbying. I even went to the State Ethics Commission in Maryland to get an official letter from them saying it's not lobbying. Why is that important? Because most of us get most of our money in the nonprofit world from foundations, from individuals who take tax deduction. That's very limited in how much we can do for lobbying. So to the extent that you can use this money for non-lobbying activities, it really helps you. And building this coalition is something you could do without lobbying money. And also, you want to have key partners who will take a lead in making things happen on the issue. Not all the hundreds of people will come to meetings and really play a central role, but you need to have a key coalition, which we did. And as David said, a lot of them are groups that are working on the funding we want to use this money for developmental disabilities, mental health, drug and alcohol abuse, et cetera. So build your coalition, and spent a lot of time on that. Have some simple information for people, but it's very important that you keep it simple and that you have just a 1-page document that you want them to endorse. Step 4, media. Anybody who works with me knows that I love to call, I love to email, I can be a real nudge, but I can't call 5 million Marylanders, right? And I consider the media a giant telephone. It's the way to reach out to the millions of people that we can't call and nudge directly. But you have to do this right. You have to focus on the media as a key part of your campaign. And as you know, there are 2 kinds of media, earned and paid. Earned media is when you get a newspaper article, when you get a TV story, when you get an editorial about your campaign. And that's very important to maximize that. And you maximize that in two ways. One, build a relationship with the reporters. Make sure you talk with them, make sure you answer their questions, and make sure you respect them. And second, make sure you do a good job of putting together events and ways to get media coverage. I mentioned the tobacco tax with the faith community. If we had done a press conference with faith leaders say tobacco is bad, that would have been a big yawn, right? But a press conference with faith leaders calling for a tobacco tax increase, that was front page of the paper. That night on TV, the icon said, God versus tobacco. You can't really beat that. Also, when we announced our study that David did, we got a lot of media attention for that because of two things. One, it was a good study showing that lives were saved in Maryland by increasing the alcohol tax. That's news. And second, we had good messengers like David Jernigan, who knows how to talk to the media. It's very important that the people you put out there are people who really know how to talk to the media. Now, one way of dealing with the media that colleagues of mine and I disagree with is a lot of my colleagues will script their speakers to the word. I don't do that. I prefer to find faith leaders and others who can speak from the heart, and I think that works better. Sometimes it doesn't work, but usually it works a lot better. Similarly, on the polling data, again, if we tried to release a poll that said the majority of Marylanders support an alcohol tax, that's a big yawn. But a poll showing that voters would switch their allegiance to support candidates who support an alcohol tax or tobacco tax, that's news, and that got substantial coverage. Paid media. A lot of us in the nonprofit community don't have enough money for a lot of TV, a lot of big print ads. But one of the ways that I think is very effective is radio. Radio is something that can get the message out, and it works, and it also gets a lot of earned media in addition if it's a good radio ad. I'm going to play a couple of them for you, some on tobacco and some on alcohol, but the first one I'm going to play is one which tried to deal with questions that were raised about the issue. So we had people saying, will tobacco taxes really reduce teen smoking? Won't this hurt poor people? So we've got a great messenger, Bishop Doug Miles, and I hope I can do this, who did a radio ad for us that I'm going to play, and then we'll talk about it for a second. All right. Let me see if I can. Excuse me a second. What? Here it is, sorry. Here it goes.
This is the Reverend Douglas Miles. For years, tobacco companies have been targeting our teens, working to addict our children to their deadly drug. Big Tobacco has put billboards all over our neighborhoods, given away free samples to get our children hooked, and kept their prices low to keep us addicted to cigarettes. Working together, we stood up to Big Tobacco and won the fight to get their billboards out of our neighborhoods. But we must do more. Raising cigarette prices will cut teen smoking, and is one of the best things we can do to protect our health. Now Big Tobacco is trying to convince us that higher cigarette prices would hurt poor people. Don't be fooled. The only people higher cigarette prices will hurt are the tobacco companies trying to addict our families. God has given us all the gift of life, and we must do our part by keeping our children safe and well. For more information, call MedChi at 410-539-0872. Paid for by MedChi, the Maryland State Medical Society, and by Smoke Free Maryland.
As you can see, that ad doesn't talk about legislation. Oh. This is a similar ad doing the same thing. All right. So as you saw from that one ad and part of the other one, what we were trying to do was get the message out that increasing cigarette taxes reduce teen smoking in a way that really can get the public to understand the importance of doing this. Because our polling showed, and this is true on tobacco and alcohol, that although people support an alcohol tax or tobacco tax, not all of them were convinced that it would actually reduce teen smoking and underage drinking. So the more you can get that message out to people, the better for the cause. So we did those ads. Oh man. So sorry about this, folks. So the paid media is very important, and we always got lots of media coverage about the radio ads, which was also very important. Here are just some examples of some of the headlines about the alcohol tax. Supporters continue to push for an alcohol tax, cheap drunk state from one end of the state to the other. And we also work to get editorial support. It's very important to get support from the big papers and the little papers. And we went to the editorial boards early on to convince them that increasing the alcohol tax would reduce teen smoking and underage drinking and alcohol abuse and provide money for key purposes. So that helped to build our support around the country. That's step 4. Step 5, elections. Now this is hard for a lot of nonprofits because they're used to educating the public, and a lot of them do some lobbying, but not many of them make their issue an election issue. And when you're facing a powerful opponent like we were, you need to make your issue an election issue, I believe, to overcome that vested interest opposition. So the first thing we did during the campaign season was to take that resolution that all those hundreds of organizations had signed and send it to every candidate. We sent it to every candidate who was running for governor and general assembly and urged them to endorse it. Now, usually candidates don't like to sign these kind of documents. They like to just run on their good looks or their party name or their whatever they want to run on, but they don't like to take positions. So our job was to force them to do so, because unless we did that, we weren't going to get our alcohol tax passed. So at this time, during the election season, is when our coalition really got revved up and was contacting the candidates and demanding that they sign these documents. When you're a community leader or a local faith leader or even an NAACP leader and you're going to talk to somebody during a legislative session, to them, a legislator, you're just another pain in the neck trying to get on their nerves, right? Trying to get them to do something they don't want. During election time, you're something very different, right? You're somebody whose support they want. Maybe they're coming to your group for an endorsement. Maybe they want money from you. And if what they hear from you is, have you signed that resolution yet for the alcohol tax, it rings differently. They need to hear from you. And that was suddenly having a tremendous impact. I'll tell you one story about the alcohol tax, which rang true about how powerful this was. There was a legislative district south of here represented last year by Senator George Della, who had been in office for 40 years and hated my guts because he had to vote for tobacco taxes and gun laws he didn't like. And we were sure he wasn't going to sign this alcohol tax resolution. We got it to him. We got it to his opponent. His opponent signed right away. The opponent who ultimately beat him. And then a few days later, we got one signed by George Della. And we were just shocked. Why would he sign that? And he signed it because he was just hearing from one end of the community to the other that they wanted this done. And then I heard that in the inner circle of his office, he was saying to people, well, you know, Ferguson's going to use this against me. I hate that, DeMarco, but I better sign this thing. And he signed it. And that was happening all across the state. That legislators who would never think of voting for an alcohol tax, thought the alcohol companies were too powerful, didn't want to vote for it, were signing these resolutions. And why was it? Because we had done steps 1, 2, and 3, and 4 effectively to get the message out. And here we were filling the mailboxes with calls and letters from constituents who were saying, sign that resolution. We put a cutoff date of August 27th, by which time they had to sign, and the results were tremendous. By the time of our cutoff date, 147 candidates from all across the state of Maryland had signed this document. And this was historic. And this is when we knew that we were going to get an alcohol tax, because we had almost a majority of both houses who were going to win sign on. And then you can see after the ultimate election, 75 actual winners who were going to be in the General Assembly had signed our resolution. And again, these were primarily people who would never think of voting for an alcohol tax before this. The interesting thing here is that during this time we were doing this, there was virtually no opposition from the alcohol lobby. And, you know, David has talked to you about how powerful they are. I told you that they blocked alcohol tax increases for 40 years in Maryland. So you may ask, where were they? Why weren't they battling you? Well, it's because tobacco lobbies, the gun lobby, they do great in the halls of Annapolis where nobody's looking. But out in the public, they're not going to counter us with a press conference and saying alcohol is good for kids. You know, they're not going to do that. They just had no response to what we did. We had the field basically to ourselves. And this was the same when I did the tobacco tax campaign and on the gun campaign. During this part of the process, all these powerful vested interests had really nothing to say. And I think that's very important for you all to understand, that this is a way to reach the public, mobilize people, affect these legislators in a way that these powerful vested interests really don't have a good way to respond. And then step 6, once you've done steps 1, 2, 3, 4, and 5, is to get into the legislature and get the job done. And now we were ready to do this. The campaign I just talked about, we started in about 2008, went through 2008, 2009, did all the steps 1, 2, 3, 4. In 2010, did step 5. We made an election issue. 2011, we were ready for step 6. And now we were ready to hold a smart hearing. David Jernigan did a great job of answering questions from legislators on cross-border issues, all the rest. You still have to do a lot of work, even though we've done steps 1, 2, 3, 4, and 5. But the difference was they were listening. Because of what we had done up till now, they knew they had to listen to us. Their people were watching. Many of them had signed that resolution. And it's very hard to go back when you do that. I remember when I was working on a tobacco tax campaign, one state senator who had signed our resolution on a tobacco tax tried to back out during the legislative session. Well, her local paper published her resolution on the front page, and she did the right thing because they know people are watching. In all these years that I've worked on this issue, since 1994, on guns, tobacco, healthcare, and alcohol, only one delegate and one senator actually voted against what they pledged to do. The vast majority of them know that they got to stick with that. And it's a tremendous base on which to build. And the leadership of the legislature, who didn't want to pass any tax. I remember in 2011, no other tax passed besides the alcohol tax, even though other taxes were proposed. And legislators didn't want to pass any tax. But because of our campaign, they felt the need to pass the alcohol tax. So we did all the basic stuff you do, and even then it was going to be tough to pass the tax we wanted to raise the dime a drink excise tax in Maryland. And then something happened out of the blue, which I'll end with, and then we can go to questions and answers. We had out of the blue, we found out that District of Columbia, which has the same excise tax in Maryland, and was one of the biggest arguments of the alcohol lobbies that we couldn't raise our excise tax above DC's, had a few years ago increased a sales tax on alcohol. And that was something nobody knew about. In fact, I called David, and David didn't know about it. The alcohol lobby people didn't know about it. Nobody knew about it. And suddenly, that was a way the legislators could increase the alcohol tax without going higher than D.C., because D.C. already had that higher sales tax. It was interesting to me that for years, the alcohol lobby people had testified before legislature that the D.C. tax is the same as the alcohol tax. I went to one of my friends who works the alcohol lobby, and I said, all these years, were you lying or just stupid? And he pled stupidity. He said, we were all just stupid. But the point was that it was a great opening for us. But that opening wouldn't have mattered if we hadn't done steps 1, 2, 3, 4, and 5. Because we'd done those steps, when that opening happened, we were ready to get our legislation enacted. And we did a great job with the coalition in general of having good hearings, having rallies and everything else. And in the end, the alcohol tax that passed will raise about $80 to $100 million a year and substantially reduce underage drinking and alcohol abuse in Maryland. One footnote, though, that's very important. As David said, and I said earlier, we had in our original proposal tied the money to some specific public health causes like health care, drug and alcohol abuse, and development disabilities. In the end, in the legislature, in order to pass it in the very end, they put a lot of the money in the first year into school construction. And that caused a lot of angst for a lot of people in our coalition. And it caused some of our opponents to shed crocodile tears over the fact that the money wasn't going to mental health services directly as in our proposal. One, our main opponent named Delegate Schmeigel. Anybody here a fan of Lord of the Rings? Isn't that a great name for an opponent? And he was saying on the floor of the House that we can't have this pass. It's just a front for the governor wanting some money. It's not going to these purposes. Well, the law passed, and what I want to emphasize to people is that we are working closely with the governor and General Assembly to make sure that after the first year, the money goes to these mental health, developmental disability, drug and alcohol abuse, and healthcare problems. And we have a letter from the governor pledging to work with us, and we're close to making that happen. So this law is great for several reasons. One, it's going to reduce underage drinking and alcohol abuse. Two, we're going to get the money going to those public health needs. And third, it's being talked about as a model across the country. David has talked about that a little. I was invited to Massachusetts to speak with a group there working on this issue, and I described this process to them. They're going to try to follow that. David had invited me to meet with advocates from across the country. I think this model for raising the alcohol tax is going to spread all around the country. Thank you very much.
Thank you very much, David and Vinny. This is the point in our program where we are now able to take questions and answers both from the audience here in the room with us and those of you watching online. And again, if you are watching online and have a question for either of our presenters, just click on the link. So why don't we get started with questions here if anybody has a question for either Vinny or David. Yeah. And if you could just wait till the mic comes around so we can all hear you online.
So where did the money come from for this effort?
Well, that's an excellent question. And money is hard to raise. And what we did from the beginning was set up two corporations, two nonprofits. One under the IRS, a 501c3 that can take tax deductible money, and one under the IRS rules, a 501c4 that can't but can do political advocacy. And we made it our business to raise both kinds of money. And we've got the money from foundations, from individuals, from unions, from businesses who cared about the issue. But one of the most important things is back to what I said earlier, make sure you maximize that foundation money. Make sure you maximize that tax deductible money and do everything you can with it. And one of the things to do is to talk to a good lawyer about it. And I have a very good lawyer. And in the book, he's Mike Predel from the Eastern Shore, who's just wonderful on this. The authors, according to the book, the author, Mike Predel, said that people once said to him, "You must be a really good lawyer, having kept Vinny DeMarco out of jail all these years." And he didn't argue with him. But what he does that's very good is tell us, where the line is we can't go over, which is important, critical. You don't want to go over that line and do something illegal. But what can you do within the line? Maximize that. And I go back to that resolution. That organizations can sign endorsing the alcohol tax or tobacco tax, getting organizations sign that is not lobbying. And you could do that with the foundation money. Now, raising the non-tax deductible money is hard. That's difficult money to raise. The election work I talked about, you have to do with the non-tax deductible money. So you have to figure out a way to get to people who believe in the issue so much that they'll part with non-tax deductible money. Or there are organizations, unions, whatever, that have an interest in more money coming to the state, and they can give you some non-tax deductible money. So it's very important to differentiate the money and to maximize both kinds. David.
And then the funding for the studies that we did, 2 small studies, and I should say I had the pleasure of partnering with an economist here at the school, Hugh Waters, on these studies, and it came from a small local foundation, the Able Foundation.
Okay. A question right down here in the front.
Dr. Jernigan, you mentioned the possibility of a minimum price for alcohol, and I know that's something that's been raised in a couple of other countries as well. And I wondered, do you think that would actually be quite effective? And also, was that raised as part of this campaign in any sort of a serious way?
No, it never came up as part of this campaign, and as far as I know, nobody's tried to do minimum price in the U.S. It is a big issue, particularly in the UK and actually right now in Scotland, where the Scottish National Party just won power and they've announced that they're going to do minimum price. There's been extensive modeling of what happens with minimum prices, and, you know, in the technical language of researchers, it's really cool stuff in terms of what you can do with minimum price to reduce the consumption of people who are drinking at very risky levels with minimum effects on the moderate drinkers.
Okay. We do have an online question. Wondering how the implementation of the tax is going this year, if we have any feedback on what kind of impact it's having or how much money is being raised.
Well, we do know for sure that the law took effect July 1 of this year, and every month between $5 and $6 million additional dollars has come into the state. So that we know for absolute certain. David tells us that the biggest months for alcohol use are December and June, so we'll see what happens then. But it's tracking at $5 or $6 million additional dollars every year. As David said, we're going to try to do a study to find out the impact on underage drinking and alcohol abuse. The most important thing I'm working on right now is to make sure that starting next year, the money from the alcohol tax goes to the public health purposes we identified. And as I said, we have a letter from the governor pledging to work with us to do that, and I'm pretty confident that's going to happen. David?
Yeah, just practically, it's going to take a couple of years for us to know what the public health effects are, but we're hopeful that we'll get funds to do that.
Okay. Yeah, right over there in the back.
Thank you. Do you have any studies that have any indication of whether raising the alcohol tax will also raise illicit alcohol use, like bootlegging?
Yeah. Again, alcohol taxes only work if you have reasonable control of the market. And in places where you don't have good control of the market, absolutely. Bootlegging, illegal production, the growth of the informal sector, and the sort of, I did dissertation research in Zimbabwe, and Zimbabwe at one point raised their alcohol tax 44%, and Zimbabwe did not control the market. The government ended up with less money coming in because of the tax, because the informal, you know, it fed the production and sale in the informal sector. But that's not much of an issue here in the U.S., and certainly Maryland isn't known for its bootleggers. Follow up, yeah.
The reason actually I asked is because I'm from Botswana, and we just started the alcohol levy. We raised it to 30%, and what we've seen the same trends as in Zimbabwe, and we're just wondering how can we control the whole situation, especially since one of the the duties of some women is to make beer, traditional beer, and it's okay, it's considered culturally okay, but now it's getting even stronger and even more dangerous.
Tell me the country again.
Botswana.
Oh, Botswana.
Yes.
Yeah, of course. Yeah, again, you have to be able to have control of the market, and particularly in sub-Saharan Africa, the tying of alcohol production to women's economic power, to the ability to raise school fees for their children. These are major social and economic issues that have to be taken into account when you're developing an alcohol policy. So that an alcohol tax, certainly a large increase may not work very well there. It might work better, though, if some of the monies were earmarked, for instance, to paying school fees, were earmarked to other economic development opportunities and programs for women.
Yeah, over here.
Yeah, I'm also from Sub-Saharan Africa, and I mean, alcohol tax is one of the ways that the WHO, recommends that countries use. And one of the challenges in Sub-Saharan Africa is what you've elaborated. But I want to know, so would you suggest that we first try to get all the illicit alcohol to become licit first before increasing the tax, or we should do it simultaneously? Because in my country, Ghana, what the alcohol producing companies are saying is that if we increase the alcohol tax, we are only going to get people to drink illicit alcohol, which is usually stronger and may get them more addicted. But at the end of the day, they are then having their field day to sell the imported beer at a cheaper cost.
Yeah. Okay, so the first thing is don't construct your alcohol policy based on what the alcohol producers tell you, because they have a clear economic interest in certain outcomes. So moving beyond that, do you want to make the formal sector more formal? Sure, and you want to do that for a variety of reasons. You want to make sure that the informal production is safe production. So yes, you do want to bring them into the market. But it's what WHO has laid out is 10 areas that you need to be looking at in terms of alcohol control. And the research literature says the three most powerful areas are price, physical availability, and marketing. And you want to look at controls in all three of those areas as well. Physical availability, we mean the number of places that people can buy it, the hours and days of sale. Again, all of which, when you've got a large informal sector, when you've got things like the shebeens in South Africa, it is a big challenge, but nonetheless, that's part of the challenge of transitioning to a public health-oriented alcohol distribution system. Yeah.
This is a bit off tax, but I don't know whether because US has got the drinking age at 21, does increasing the minimum drinking age has any correlation with the tax?
Yeah, I mean, it's a similar situation in that the lesson of alcohol policy is it's always a dance with the population and with the culture in terms of what will the traffic bear at a certain point. And pushing a policy in a public health direction will promote debate, will in and of itself raise awareness about alcohol problems, and so on. The minimum age in the US worked even when we enforced it poorly. And it works a whole lot better when we actually devote dedicated resources to enforcing it. But again, you have to look at that issue of enforcement and the degree to which taking a step like that in your national culture, will that promote respect for alcohol control, or will it decrease respect for alcohol control? Will it feed your enforcement efforts in other areas as well, or will it undercut them? And I can't answer that without looking at the situation.
Okay.
I will say, I mean, the U.S. research on 21 is incredible, but this is quite a controlled market.
Brad Herring from Hopkins. This is for Vinny. I'd like to get your reaction to the following comparison. It seems like your strategy is actually quite similar to that by Grover Norquist for the Republicans, right? Getting them to sign these new taxes pledges. I mean that actually kind of as a compliment, because
to me or him.
Because I mean a compliment in terms of like how successful you've been, because Grover Norquist has been very, very successful in getting the Republicans to all stick to this no new taxes pledge. But you're just kind of like, bizarro Grover Norquist at the other end of the ideological spectrum. Can I get your reaction to that?
Well, I guess I'm honored by the comparison. The difference, I think, is that for me, that pledge or that resolution is only a part of a broader plan. I don't know a lot about Grover Norquist's whole plan, but I think it's kind of the core and the what it's all about. And he has been effective. But I think in the long term, this process is, I think, more effective because it builds that broad popular support. Before we talk to the first candidate about signing a resolution, we have spent years reaching out to the public, getting endorsements from organizations, using the media to teach people about it. And I think it's long term more effective. One interesting thing is, Grover Norquist calls what he does a pledge. And he's given that word a dirty name for a word for some people, particularly progressives. And I'll never forget when I was working on this, and I used to call what I did a pledge, and I sent it out to all the candidates to sign this pledge. And this one candidate, a progressive woman who supported what we were doing, she called me and said, "Vinny, I am never signing a pledge again as long as I live. I hate him because of Grover Norquist." So I said, "All right, well, delegate, how about if we call it a candidate's resolution?" She said, "Well, I'll sign that." So that's what we call him from now on.
This is sort of the Mutual Admiration Society up here, but I think the other big difference between Vinny's work and Grover Norquist is that Vinny's actually working on evidence-based strategies with big bodies of public health research behind them about the effectiveness that it will have for the population. I don't know that Grover Norquist has any of those studies on the no tax pledge.
We have a question here.
A related question, and this is, I'm just curious if the model and the approach that you guys have taken with tobacco and alcohol and guns would be as effective for some of the movements with regard to chronic disease, like things like the tax on drinks and that kind of thing.
You ask a great question, and the question basically is, would this same strategy apply to reducing childhood obesity by increasing tax on sugar-sweetened beverages? And we've been asked that. And, there are people in the community who have asked us to take on that issue also. And we're basically, looking at it to see if it would apply. My concern is, I think on step one, if you look at the 6 steps, step one, there seems to be powerful data that increasing tax on sugar-sweetened beverages would reduce childhood obesity, reduce use of those sodas. It's not as strong as on tobacco and alcohol because it hasn't been done a lot. So the number one isn't as strong. It's there, but it's not as strong. Number 2 is the critical one, the polling. This process that I've described works when you have really strong public health evidence and broad popular support. The public is there. I mean, people need to be educated, need to be mobilized, but the public's there. That's when you can do this policy. On tax on sugar-sweetened beverages, we're going to do some polling to look at. Others are doing it also. The polling I've seen from other states doesn't indicate that the support is there. I've seen support as low as 30 or 40% to maybe 50%, and I've never seen the kind of 3 questions that I just described. My guess would be you will not find that kind of switch of voters on this because I think the vast majority of people really don't understand that sugar-sweetened beverages would have this bad impact, and increasing tax would reduce it. The other point is on tobacco, only 15 to 20% of people smoke. On alcohol, as David pointed out to us, 70% or 75% of people either don't drink at all or drink only a modest amount. So the tax on both would only affect 20% of the people. Soda, it's going to affect a huge number of people. And the final difference is the opponents. Tobacco companies are very unpopular. Alcohol companies are not as unpopular, but they're pretty unpopular with a lot of people. Soda companies are through the roof popular. Pepsi and Coke are very, very popular. So for those reasons, I'm not sure this kind of campaign would work on that. So the question you may ask is, if you have strong evidence, what do you do if this kind of campaign doesn't work? Well, then I think you need to educate the public about it and kind of do an expanded step 3, is to really get out there and show the public through these faith groups, through these community groups, about the importance of it. David, join.
Okay. Any other questions?
Sorry, this question is a little bit on the periphery of your talk, but just want to get your reaction to a few years ago there was a sort of a campaign, for lack of a better word, to reduce the drinking age to 18, and a lot of the college university presidents actually signed this. I want to get your reaction on sort of your reaction to, one, that, and just two, how campaigns like that might affect sort of other public health campaigns like yours.
So I'll do the first part, maybe you can do the second part. So in the first place, it wasn't a lot of college presidents. There are over 3,000 presidents, and about 300 of them signed this thing. It did get a lot of media attention, and college presidents have a big problem in that they are incredibly competitive as institutions. They're trying to both promote the intellectual atmosphere and, frankly, the fun of being at their school. And when you come to alcohol policy on a college campus, you're caught right in the crosshairs of that issue. How do you have a fun and intellectually stimulating environment and make it safe in terms of alcohol? And alcohol drinking on college campuses is a huge problem. This is the one population in the U.S. where 21 made no difference. The kids in that age group who are not in college, which are the majority of the age group, reduced their drinking as a result of 21. The college age students didn't. So that said, the College President's Initiative was enormously misguided. It was informed in part by one of my least favorite fantasies about alcohol. As a colleague of mine puts it, everyone wants to believe in a mythical land where children are served brandy for breakfast and no one ever has any problems. And the fact of the matter is that land doesn't exist. It doesn't exist in Italy or in Spain or in France, and it certainly doesn't exist in Anglo-Saxon countries like the US, where our drinking style, our drinking pattern is, frankly, it's drinking to intoxication. That's the cultural style. So with all that in place, I can understand why college presidents would be tempted. But there are a couple of initiatives happening now around the college drinking issue. There's a learning collaborative that's been organized by President Jim Kim from Dartmouth. About 30 institutions, including 2 here in Maryland, are part of that, to try to apply the learning collaborative model from public health to see if they can move the needle on college drinking. We're in conversations with the Department of Health and Mental Health here in Maryland about doing a comprehensive program here in Maryland, perhaps using some of the alcohol tax revenues. And the National Institute on Alcohol Abuse and Alcoholism is reviving their own college presidents initiative. It is critical that we get buy-in from the top, college presidents' commitment to actually taking the problem seriously and not throwing up their hands and saying we can't do anything about this. But it's also critical that any successful approach on college campuses is also going to engage students, faculty, staff. It has to be, as I said to the question before, alcohol policies have to be made and they will be implemented in the context of the communities that they're designed for, and that community needs to be engaged in the process. That said, I think there's a lot more we could be doing on college campuses to make them a heck of a lot safer places.
Okay. Yeah, do we have
a question? Vinny, about the coalitions that you were talking about and the lead coalitions, I noticed that like 2 out of the 4 were labor unions, SEIU and UFCW.
Right.
Could you talk a little bit about those partnerships and their motivation to participate?
Yeah, it's a good question, Janie. And one of the obstacles to passing the alcohol tax in Maryland over the years has been the opposition of some labor unions. And there's a distilleries union that opposes raising the alcohol tax. They also oppose raising the tobacco tax, tobacco union also. But what we did was we reached out to some unions that had a strong interest in health care, particularly SEI, Service Employees International Unions, 1199, and United Food and Commercial Workers, that have always been strong supporters of health care. And they supported our tobacco tax campaign and saw the benefits of that. And we convinced them that it makes sense to support alcohol tax. And they did, and they were critical partners. They were critical partners because it made clear to the legislators this wasn't just the public health community. We had the faith community, we had labor, and that made a huge difference. In fact, 1199 SEIU also paid for a radio ad specifically on increasing the alcohol tax, which helped make a big difference toward the end. But the one thing I want to emphasize is that building this coalition was not something we did overnight. And one of the biggest mistakes I see advocates making is that they try to pass some legislation, they run into an obstacle and said, oh, we better build a coalition by next week. Building a coalition was what we did for 2 years or more, and spent some time talking with people, answering questions, addressing concerns, and reaching out as broadly as possible. And for that reason, when we were ready to move the legislation, we had a real powerful coalition behind us, including these 2 prominent unions.
We're getting close to the end of our time, so we have one last question online that I think is a good ending point. And the question is, what issue are the 2 of you planning to work on next?
Well, funny you should ask that. It's a great question. And we are committed to achieving health care for all in Maryland. And that one of the uses of the tobacco tax we passed in 2007, besides reducing smoking, was to expand healthcare to 250,000 people. We are now working on using money from the alcohol tax to help make healthcare happen, but we still need more money, and we want to reduce smoking some more. So we have now proposed something called the Healthy Maryland Initiative, which is proposing another $1 increase in a cigarette tax, plus an increase on tax on cigars and smokeless tobacco, which will further reduce tobacco use in Maryland and save lives, and bring in up to $100 million, which we can use for more healthcare. And if you're interested in that, go to www.healthcareforall.com, and you could be one of now over 300 organizations that have endorsed this new resolution.
It's not a short answer, but I'll try to be brief. On this issue, I think Vinny and I are both trying to take this to other states and to encourage other states to look at the model and see the degree to which it's applicable. I mentioned trying to fill in some of the research gaps, but my center here at Hopkins, the Center on Alcohol Marketing and Youth, really focuses on the big 3 out of the WHO list of 10 on physical availability. We're looking at outlet density here in Baltimore City, on the tax issue, and on the marketing issue. And we do a tremendous amount to try to reduce the degree to which young people are exposed to alcohol advertising. And if you want to know more about that, you can go to our website at www.camy.org, CAMY.org. The other thing we're working on, though, and I want to speak to the folks from other countries in the audience, is this is a huge cause of death and disability worldwide. Much larger than many people are aware of. In the wealthier of the so-called developing countries, it's actually the #1 cause of early death and disability in the world. Given that that's the case, the World Health Organization has a new global strategy, and we're doing everything that we can to support that strategy. and there'll be a major conference in Bangkok in February. We're expecting over 50 countries, about 1,000 people. It'll be a really landmark event highlighting the global strategy, highlighting the critical importance of this as a public health issue worldwide, and hopefully leading to much more meaningful action to reduce the situation that we're finding in so many countries.
Okay, great. Thank you both very much, and we all hope to see you next month for our next grand rounds. And thank you very much to David and Vinny for a great presentation.
Thank you.
Thank you.